then my previous employer, I worked for them for 3 years without health care. And, 40 plus hours a week, small business, worked off of, made commission off of my job. And I actually asked them several times, because it was a small business and there was only 6 of us that were employed there, and they offered one person health care, and somebody that had been with them for 10 plus years. And I, wouldn't it be cheaper for us all to do a group plan? But they didn't want to pay the money. Third day of my cycle for chemo that week, and I go in to the hospital, and they said, "Oh, well, you need to go to the business office before you come see us, and you need $3,000 today, $3,800 to be paid today in order to be seen today." And you don't want to be there anyway. You don't want to go and do the chemo. You don't want to go and do the radiation. You're tired and you're sick. But you have to. You get up because you have to. And then someone tells you, "Sorry, you can't be here because you don't have any money." And I go home and I beg, borrow, beg and borrow. No stealing, just beg and borrowing. But just to get poison pumped into you. It's terrible. But it's a terrible feeling. We won't treat you because you don't have the money. And without being treated, you die. So figure it out. And I don't know. There's nobody in my life that I know that can just go, "Okay, well, here's $3,800. It was an accumulative effort. It was max out this credit card. Mom's gonna max out this credit card. I'm gonna max out one. And I had a friend that lent me some money, which I'm still paying back because I don't want to lose the friend. Because they came through in a time of need, but it's a terrible feeling.
One of the nation's biggest health insurers has agreed to pay $50 million to settle accusations that it overcharged millions of customers. New York's Attorney General charged United Health Group and its subsidiary Oxford with using a research firm the company itself owns to manipulate reimbursement rates. The result here was that customers ended up paying far more for so-called out-of-network medical costs than they should have. United Health said it disagrees with the charges of manipulation, but they settled the case, they say, to avoid accusations of conflict of interest.
This might be an unexpected comment coming from someone in my position, but our governments are the perfect change agents for healthcare, with some of the best leverage points to advance modernization of healthcare as a system. Government can act as the ultimate progressive healthcare customer, demanding involvement and alignment with its modernization agenda from the healthcare community. And if you're not with their program, you could suffer the consequences of lost business or lost funding.
So I'm back on Oregon Health Plan now, and with many, many restrictions. They will only allow one PET scan in your coverage forever, and I have to see if the cancer's spreading, and so those are all still things that I have to pay for, and just the stress is terrible trying to figure out what you're gonna do. And we live in this great nation that should have a better plan for people like me. And it's stressful, it's unfortunate, and it's sad, because I'm not the only person that goes through this, and it's hard. So, hopefully, sometimes I just feel like I'm waiting to be kicked off again. they're going to skim the top again, and I'm going to be out, and then I'm going to have to figure it out. So that led us to having a garage sale, which the hospital gave me a settlement amount. Pay this amount by this date, and then you won't owe us anything more. And it's thousands less than what I owe them. So that's what brought us to our garage sale, and it's kind of an innovative way to make some money and make the debt go away. But it shouldn't be like this, you know. Living in the United States, I shouldn't have to do this. You know, fortunately, you know, I know a lot of good people, and my mother knows a lot of good people that have helped out, but this is definitely not ideal. Living on your own, raising your child by yourself, and then it's all taken away, you know, with a loss of a job or an illness, in my case both, and it's pretty dehumanizing, you know. It's frustrating because I can't do anything about it. I can't help the way I feel like I should help.
My mother died of cancer at 53. In those last painful months, she was more worried about paying her medical bills than getting well. I hear stories like hers every day. For 20 years, Washington's talked about healthcare reform and reformed nothing. I've got a plan to cut costs and cover everyone. But unless we stop the bickering and the lobbyists, we'll be in the same place 20 years from now. I'm Barack Obama, and I approve this message because to fix healthcare, we have to fix Washington.
The challenge is, how do we get the federal government to take care of its business? I happen to be a proponent of a single-payer universal health care plan. Everybody in, nobody out. A single-payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back the House. Everybody in?